Hi, my name is Tanj and I'm a Foundation Year 2 doctor at the Brighton Sussex University Hospitals Trust. And come this August, I'll be starting core surgical training in Wessex. I originally went to university medical school to become a medical doctor, but what I found during my years at medical school was that I enjoyed the surgical rotations the most. I really got a great satisfaction by getting things done, getting physically involved, and what I find is that surgery has a great mix of acute and chronic disease management, and it's one of the few specialities that's truly focused on what I feel is making a difference or curing our patients. There's a greater focus on greater focus on treatment rather than prevention and management. I confirmed my choice to apply for core surgical training in several ways. One of the things I did was that I was lucky enough to have done a surgical rotation in my F1 year, but I also swapped one of my medical rotations in my F2 year for surgery as well. That way I could experience what it was like to be a surgical SHO. And I found that I really enjoyed the greater responsibility, I really enjoyed getting stuck in, and I enjoyed my time in theatre. The other thing I did was I spoke to my seniors, and I did that for two reasons. One, I wanted to find out what they thought of surgery throughout the years that they'd been practicing and what they thought the future of surgery would be like. But I also wanted to see whether they thought I was a good mix for surgery as well. I think it's difficult to have a true plan B when applying for core surgical training. And the reason is that you really have to demonstrate your commitment to surgery. It's a difficult position to get. So my plan was that if I hadn't got in, I would take stock of what had happened, see if I still really wanted to do surgery and whether it was still for me. I was then going to spend the following year, because I'd already had my MRCS Part A and my basic surgical skills course, I was going to spend the year doing 6 months of A&E and 6 months as a surgical SHO locuming in another trust. The reasons I was doing that was because I wanted to get more exposure to acute medical and surgical management through A&E, but I also wanted to see what surgery was like in other trusts and see whether it still infused me the way it did here. I think the key is that through it all, you've got to enjoy yourself. If you find yourself, a slave to ambition and you don't enjoy what you're doing, then you're not going to make a good surgeon. However, it's important to point out that surgery is very competitive. The competition ratio is quite tough and some of the toughest in the country. What my plan was that I would, as I mentioned earlier, swap one of my medical jobs for a surgical job. I'd get more hands-on experience. I'd also get an idea of whether I still enjoy the rotation. The other thing I planned on was I was going to get one paper published, one audit, and at least one presentation. Now that can seem quite daunting, but there are shortcuts and there are little secrets that you can use. Invariably, in any trust or any department, there will be a lead for research. And so what you have to do is you have to make yourself available to that person and show yourself as someone really keen and willing. And I did that, so I managed to get a paper out in bariatric surgery. The other thing that the trusts often do is they may have leadership projects. And again, I was very lucky at this trust, there was a surgical leadership project, so I signed up for that as well. And so I did commit myself quite heavily in order to make myself have a good application. I also made sure that I gave myself time to study for the Royal College of Surgical exams and also the basic surgical skills exam. Having said all that though, it's also important to enjoy yourself, and you can do that and still make a good application. I think it's important to approach the application form with a lot of time and a lot of effort. When I applied, the application form wasn't critical in getting you an interview, but it was very important in shortlisting, and particularly if you drawed in your interviews, they did fall back on the application form. The application form questions aren't there to trick you or to confuse you. However, it is worth going through the person specification and also the applicant guide for core surgical training. And like I said, have some patience, have some time, fill the questions out, and if possible, get people to read them before you submit it. The interview for core surgical training is divided into three parts. The first part is the portfolio section. It's really important to do well at the portfolio section. It's weighted fairly heavily for starters. The other thing is that the portfolio is almost a representation of, or an embodiment rather, of who you are as a surgeon. So it's got to be clean, it's got to be organised, it's got to be well structured. I used the person specification for core surgical training, and I found it very, very useful. It gave me a very good framework on how to structure the portfolio. And if you have anything interesting that you want to put, you can always create a section at the back and put it on there. The second section that I had was a clinical skills section. Now, in the clinical skills section, it's important to know your ABC, to have a good framework for dealing with acute medical and surgical cases. And you'll be given a scenario, for example, a road traffic accident or someone falling off a scaffolding or something, and you'll be asked to manage that. Now, the Royal College of Surgeons runs a course called CRISP, which can help you prepare for that, and it also provides a very good framework for the questions. The final section of the interview is called the communication ethics or management section. By different deaneries will call it different things. Now, there's a lot of textbooks and materials out there that can help you structure your questions and structure the answers that you have for the questions. And I'm not going to go into them, but there's lots out there. The only other thing I would say is it's very, very, very worth your time sitting down and practicing interviews and interview technique with other people. The more you can do that, the more you'll benefit. I feel I'm lucky that I got in. It's very, very competitive, and so I'm grateful that I got in. But you always play back the interview in your head, and you look back and think what you could have done better. And I think the thing that I should have done was I should have practiced more. It's really, really important to practice the interviews, and you can do that with your friends, with your peer groups, with family members. But to get the most out of it, I would recommend speaking to either current core surgical trainees or very new registrars. The reason I mention them is because either they will just have had an interview, or they'll be preparing for an interview themselves. Number 1, read the job specification. Know what you're applying for and know why you want it. Number 2, during the interview, show that you want this. Demonstrate that you're committed. Core surgical training has a relatively high dropout rate, so get some experience, think about some exams or courses, and be enthusiastic during the interview. Number 3, think carefully about where you apply. Core surgical training is really competitive, but the training elsewhere can be equally as good. Number 4, make sure your portfolio is tidy, organised and clear. No one wants a disorganised or messy trainee. And number 5, I would say practice, practice, practice. Practice the interview skills with anyone you can, all the time.